All right, kia ora, good afternoon, everybody. Starting with the good news first. There are no positive cases in the community to report. Nearly 7,000 tests were processed yesterday, of which 2,100, or around about 2,100, were in the Wellington region. That's around 5 times the number of tests that were processed the day before that. Yesterday was the 4th biggest day in the history of the Healthline service, with a very large number of calls to Healthline regarding COVID-19. So I'd like to send a particular shout out and a particular word of thanks to those people who are working at Healthline. They've been working very hard to scale up the number of people that they've got on the end of the phone so that those wait times can come down. They did have quite a high average wait time yesterday. They're working very, very hard to bring that wait time down, and I want to thank them for their ability and the way they are adapting in these circumstances. We do expect that there will be further high demand for testing today. Additional testing centres have been stood up in Wellington City, including Haitaitai Park, Karori, and the Wellington Regional Hospital. There are also a number of testing centres operating throughout the region in Porirua, Johnsonville, Upper Hutt, Lower Hutt, Kapiti, and at various medical centres, including an after-hours clinic and, of course, in the Wairarapa. I was advised coming down here that the current wait time across the testing system sits at around 10 to 15 minutes. Details of all of the testing sites are available via the local district health boards, so Capital and Coast, Hutt Valley and the Wairarapa, and on the Health Point website. Many GPs also do COVID-19 testing. However, if you want to get a test through your GP practice, please ring them first. Most of those practices have particular places they want you to go and particular processes that they are following to keep themselves and to keep you safe. We do expect to do thousands more tests across the Wellington region today and again tomorrow. If you can't get a test today, please stay home and isolate. If you're in that category of people who needs to be getting a test, stay home and isolate and get one tomorrow if you cannot arrange to get one today. High demand for testing is a good thing. It is to be expected, and we want to ensure that everyone who needs to get a test can get a test. So if you are not one of the people who is in the locations of interest and you are not showing symptoms, please make sure that that testing is available to those who are in those categories. We're still waiting on the results of the genomic sequencing from Australia for the case. However, we've been advised that the partner of the case is asymptomatic and has returned a negative result. We're following developments in Sydney with interest, as you can imagine, and we'll also be focused, of course, on managing our own response here. So a quick reminder of the Alert Level 2 behaviours that are in place for Wellington, Wairarapa and the Kapiti Coast. Gatherings are limited to no more than 100 people. People should stay 2 metres away from others in public spaces and at least a metre away in other places like workplaces, cafes, restaurants and gyms. Face masks remain compulsory on public transport, and we encourage people to wear face masks where they are in an environment where social distancing is difficult. Businesses can open, but they must follow public health rules, which includes physical distancing, record keeping, and a cap on the number of people, so no more than the 100. In hospitality, people need to be seated, separated, and have a single server. All schools and early learning services are open, and all children should attend unless they are sick. Early learning services, schools and kura are familiar with the alert level requirements. They've dealt with those before and they've responded very well to this change in alert levels from the feedback we have received so far. A reminder, this is not a lockdown. These extra precautionary measures that we put in place at COVID-19 Alert Level 2 remain in place while we trace and test everybody that we need to. That helps to keep them and to keep everybody else in the community safe from COVID-19. What we've seen over the past 24 hours has been encouraging. We've seen high testing numbers so far, no positive test results. We expect the number of close contacts and casual contacts that we're asking to be tested to increase as the contact tracing effort continues. And though the results of all of that work, including the testing results, will help to guide a decision when Cabinet meets to review those alert levels, which we will do on Sunday morning, and we'll make further decisions then. We'll keep you regularly updated between now and then, though, but we won't be making further decisions unless there is a need to escalate. We won't be making further decisions until Sunday. So I'll now hand over to Dr. Bloomfield with a bit more of the detail on the case investigations, and then we will take questions.
Thank you, Minister. Kia ora koutou katoa. So in addition to there being no COVID-19 cases in the community to report today, there are also no cases to report in managed isolation. Yesterday, health officials in New South Wales, as I described, confirmed that epidemiological link of the person who tested positive here and travelled over the weekend to Wellington, that epidemiological link to the Bondi cluster in Sydney. This is reassuring. It confirms and fits the pattern of infection that the person was experiencing, and the test results pretty much confirming that link to the Sydney outbreak. The whole genome sequencing will, of course, further provide evidence of that. We're confident, we're expecting that later today, and will, of course, give us the picture around the variant. So saying, our response is the same regardless of the variant. As I said yesterday, it's been reported that the person is reporting they had a dose of the AstraZeneca vaccine about 10 weeks ago, and likewise their partner has also received the first dose of a vaccine about 3 weeks ago. Today does mark 5 days since the visitor was in Wellington, and the test results we get over today and tomorrow will help determine our response over coming days. As will wastewater testing, which is now being done daily in the Wellington region. I do have the results back from Monday this week, the 21st. Those results were negative. The samples taken yesterday will be, we will have the results of those tomorrow. In the meantime, what will help enormously is if all Wellingtonians observe Alert Level 2 restrictions, and in particular, most importantly, if you are unwell, do not go out, stay home and call up about getting a test. As the Minister outlined, there is a range, there are over 50 testing sites across the Wellington region. Our general practices have stood up extra capacity, as well as the existing community clinics and additional testing sites that have been put in place. There will be an additional central city testing site established either later today or tomorrow, and we will have more information about that available this afternoon. The current capacity is for about 3,500 tests today, and by tomorrow that will be for another 4,500 tests that could be done in that single day. As we have learnt from the Auckland experience, it's very important that over these next couple of days, the people who need to be tested are the ones who are tested. And just on that, if you are a contact of someone, or if you work with or live with or know, have spent time with someone who has been at a place of interest, a location of interest, you do not need to isolate and be tested unless specifically instructed. Moving on to contact tracing, as of 8 a.m. this morning, we had 420 contacts in our national contact tracing database. These are people who have been identified by either having called Healthline or having turned up to be tested and indicated that they had been at a location of interest. It also includes the 58 people who arrived on that Qantas flight early Saturday morning with the case and their partner. Of those 58 passengers, all but 5 have been spoken to. 7 of them have actually returned to Australia. And we're ongoing efforts, of course, to reach those other 5. All of those people on the flight are close contacts, so they will be in isolation for the full 14-day period with testing throughout that period. I can also say that there is no one who flew on that outward flight, Air New Zealand flight, back to Sydney on Monday. No one has returned to New Zealand who was on that flight. So those people are either all in Australia or have travelled onwards. The public health colleagues at Regional Public Health are reporting that the case is extremely helpful, and where there is regular communication happening with the person. We're very confident about the history we have now, backed up, of course, by the very regular use of the app, and it shows the value of the app in terms of us being able to get those push notifications out. Yesterday, I think there were 65 people who received a push notification. Yes, we saw yesterday an increased use of the app, but up by about 100,000 scans. I think we could grow that exponentially and encourage people to scan. You never know when it might be needed. Two final things, clarification about one of the locations of interest. Jack Hackett's and Four Kings Bar share the same QR code. Both are regarded as locations of interest. Some people may have called Healthline and be told if they were in Four Kings, then they don't need to isolate and be tested. Our updated advice, and this will be reflected on our website, is that people at both those bars, I understand they are on different floors in the same building, are considered to have been in locations of interest, and they should follow the advice on the website. Finally, just to reiterate, there is a Section 70 notice in place signed by the Director of Public Health, Caroline McElnay, that actually places a legal requirement on people who were at locations of interest at the stated times to follow the instructions that are on the website. It's not optional, it is actually a legal requirement and is enforceable. Thank you, Minister.